So this is a combined C Calvert and Mission on Women. It's and the reason we started this some time ago was to help people gain housing here in Calvert County that may be disadvantaged. The initial target were people that had uh, descendants of those who had been enslaved, or those who were working in the police department, fire departments, things like that. But the housing market had grown so much here in Calvert County that it was difficult for them to afford living here. So Calvert Concepts was the idea that came out of I forget where, to help these people with obtaining housing or in starting a business by offering matching funds to help people out. As I said, my name is Michael Kent, one of those descended from people who had been enslaved. My family has been here in Calvert County since 1780. They had the opportunity to leave in 1814 when the British came here and started burning everything down and trying to get people to run away. And my family was one of those families that said, no, we'll stay here in Calvert, not because it's that great, but because other family members had been sold away to other areas. And so they had no idea where to go to look for them. So they figured sooner or later they're going to come back here to Calvert County because they knew that's where they started. Will come back to look for their family. And other families did the same thing. And that's why there's such a population here in Calvert County that is very old in some cases. The families have been here a very long time. So to get the evening started, because we're a little late now, I'm going to turn this over to the chair, Catherine Mark. Catherine.
Thank you. My name is Catherine. I am here on behalf of the Calvert County Commission for Women. One of the missions for the Commission for Women is to look for issues for education on topics that are important to women or young girls. And when we did a survey in the county, financial literacy was one of the topics that came back of quite a bit of interest for women and girls in the county, which is why we were very excited to partner with the library and with C4 on this topic. Now, able to start talking to Perneita Farrar back in January. And I will say, when we first came up with a topic to talk about Medicare and Social Security, the big, beautiful bill was not in any of our imaginations. And we didn't thought not a lot of people know before they're on Social Security or before they're on Medicare what they need to be looking for. So we thought it would be a good topic. The good thing is, as an attorney, Perneita knows to read bills and what potential changes are. So as opposed to relying on news stories or anything else like that, we've brought an expert. So Perneita Farrar is an attorney and a disability rights advocate. She's a native of Washington, D.C. She earned her bachelor's and master's degree from the University of Maryland, and she went to the University of Baltimore School of Law. She did a clerkship at the District Court of Baltimore City, and when she completed that, she began her solo law practice. Her practice focuses on estate planning, elder law, and works with effective estate plans, probate administration, asset protection, and Medicaid planning. She brings her prior career experience in public health, which was an entire career before going to law school, and financial literacy and professional training. Her clients understand the importance of protecting their assets as a means to create generational wealth for their families. So Perneita, thank you very much for joining us. She's given me the disclaimer. It's a really big bill. She's here for the limited purpose to talk to us about Medicare, Medicaid, and impacts on Social Security. We're not going to go into SNAP benefits. We're not going to go into about 1,000 other pages in the bill. We are limited to those parts, but she is very happy to take questions, but we're going to turn it over now.
Thank you. Fantastic. Can everyone hear me? You want to wait for that? Okay. All right. Well, good afternoon. Good evening, everyone. I am glad to be here. As Ms. Marsh said, we met a while ago. I met Kip through, I don't know, just some basic networking. And we just talked about our shared passion for financial literacy, education, generational wealth, those types. And okay, well, I'm going to get started actually, and again, I'm going to just go over some of the highlights, and if you have questions, I think the questions are either being fielded, or if you want to write them down, and then once I give the presentation, you can ask questions. And if you have questions regarding Medicare, Medicaid, or Social Security that's not included in my presentation, feel free to ask those questions. If I'm able to answer, I'll answer those as well. There we go. All right, some of the just highlights of this bill. This bill was passed by Congress just over a month ago, July 3rd. It was passed into law on the next day. The the big in the one big beautiful bill really comes down to how much money or is being the budget office is estimating this big beautiful bill is going to cut in American budget. So it's looking at $990 billion. If you, most of us either can count a million or have a concept of a million, but a billion is a million millions. That's a lot of money. And we're talking almost a million of those. So $990 billion, the Congressional Budget Office is estimating that this bill is going to either cut or repurpose somewhere. And when it comes to the Affordable Care Act, or ACA, or Obamacare, how some people know it, it's looking to cross over to $1 trillion in cuts. So in full implementation, and you'll see in the next slide, this bill is gradual over the next couple of years. So some things went into effect immediately in this year, 2025, and then over the next few years up to 2032, some of the other factors will be implemented on a gradual basis. But when it comes to Medicare and Medicaid, which is what I'm kind of focused on in this presentation, it's the way it's written, it's estimated that 15 million people will become uninsured, based on this bill. And when I say uninsured, I mean particularly in the Medicare and Medicaid space. We're not talking private insurance, employer-sponsored insurance, or any of that, particularly just Medicare and Medicaid. 7.5 to 10 million of those people are likely to have their Medicare coverage actually terminated. And there's, in the Affordable Care Act, there are some premium tax cuts that are currently allowed. Those are going to gradually expire. They have expiration dates that are tiered or staggered. And what the bill does, or what it proposes to do, is, I don't know if most people have the general concept that Medicaid is technically a state-run program. However, it does receive federal money in order to pay for the products and services that the state actually administers. So each state, Maryland, gets to decide how to run their program regarding eligibility rules, enrollment rules, how much money each particular program actually can use for what services. However, in order to get or be eligible for certain federal funds, then the incentive is you must do what the federal government wants you to do with that money. So what this bill does is it actually cuts a substantial amount of Medicaid funding, and that shifts the cost to the state. And as you can imagine, the state budget would just not be able to fund Medicaid without the federal subsidies. Otherwise, they'd be having to borrow the money from our school systems, our roads and highways, transportation, and all of the public services that other money is used for. So without federal funding, our Medicaid program would likely just collapse. There are a lot of the cuts that are happening are targeted towards non-US citizens or those who are not, what's the term they use? Who are not legally or do not have legal status as an American citizen. So a lot of the cuts are specifically targeted to populations. There are, you know, exceptions for Native Americans and tribal lands and things like that. So that's kind of some of the highlights. I'm going to just, and I don't have a lot, I think about 6 or 7 slides. And then I would like to open it up for questions because actually, you know, you all will be more versed on what's interesting to you or what is impactful to you directly, your families, your homes, your circumstances. So I find that to be more helpful than to just lecture about, you know, legislative talk. All right, so I mentioned before that the One Big Beautiful Bill has a timeline of these cuts. It just didn't get signed on July 4th and then everything gets cut off and people are just going without health care the next day. Some of these changes are gradual. Some of them will be played out over the course of the next 7 years until 2032. Some of them will be permanent. Some of them are temporary. So I just want to go over and highlight the timeline over the next couple years. So in 2025, and I'm sorry that I'm not facing you. In 2025, so what happened automatically already this year? There's been a moratorium or a stop on Medicaid eligibility rules. And, you know, that's a kind of a broad thing. So when I say moratorium, meaning they didn't just like say there's no eligibility rules, they stopped the states from being able to change or alter their eligibility rules because ultimately this bill is going to direct or at least severely impact the eligibility of, you know, those wanting or needing to enroll in Medicaid. One of the other things that happened or will happen or has happened this year, I don't know if it's October 1 or November or at the end of the year, but for nursing home care, nursing home level care, there is currently a standard level of care or ratio for patient to staff. So that has been eliminated for now. So like, I don't, and this is particularly for long-term care. So in nursing homes, particularly, I believe it was for every 5 to 7 patients, there had to be 1 staff person. That limit has been abolished for now. So, you know, as you can imagine, nursing home care does not have a good reputation already for giving the most attentive or premium care, particularly in the ones that are covered by Medicaid and not private pay. So by removing that standard that there needs to be a certain amount of staff to properly take care of patients, that, you know, I mean, that means there could be 100 people and 1 staff person working, which I don't think any of us, you know, thinks that that's a good idea, but, you know, that's what happened. So when I talked about this bill is targeting or really it's most impactful for non-US citizens, and that's exactly what it does. So Medicare, which is, let me just back up a little bit. Does anyone have any questions or need me to just quickly distinguish between Medicare and Medicaid? Does everybody have a good idea? Sure, really quick. So Medicare is a, let me start. Medicaid is a need-based program where citizens and non-citizens alike can apply for health care coverage that's paid for by the state based on your income level. So there is a formula that each state is different, but a formula that's based on the national poverty level, that if a person meets that eligibility, as well as a asset limit, in Maryland, it's $2,000 in assets, and the income is based on the national poverty level. And so if you meet those eligibilities, you can have state paid for healthcare. And usually that, you know, it covers hospitals, doctors, prescriptions, and things like that. Medicare is not a asset-based income. It is an entitlement program. So for those of us who have worked and worked over a period of time and has paid into the Social Security system, you know, when you get your paycheck and, you know, people say, who's FICA? That money goes into our Social Security system, where later when it's time to retire and we get our retirement Social Security, Medicare at the age of 65, everyone who has paid into the system is entitled to receive Medicare. And Medicare covers in generally 80% of, you know, hospitals, doctor bills. You know, there's all kinds of programs, advantage programs that you can get different variations of coverage. But in essence, Medicare is an entitlement program that's based on each American citizen pouring into the system, and then you get, you know, a piece of your money back at 65 to help cover your health care. Medicaid, you don't, it's not tied to a work history, it's tied to need-based. So income and asset eligible determinations are a factor of whether or not a person is eligible. Yes. Yeah, so dual eligible persons are people who are entitled to both. And that's a really specialized, it's a very small percentage of the population, like less than 10% of people are eligible or dually eligible. That means if you qualify or if you are receiving Medicare, and I also say people under 65 can get Medicare, but that would be based on a disability. So people, young adults 19 to 64 can receive Medicare if they are receiving Social Security, you know, disability income, whether that's SSI or SSDI. And so for those people, and they may also qualify for Medicaid based on the income and assets, but also because of their disability are receiving Medicare. So those people are considered dual eligible. And what happens, or Medicare is usually the first payer, and whatever Medicare doesn't pay, that after the 80%, Medicaid is a catch-all. So it'll pay the extra 20%, it'll pay prescriptions, it'll pay for medical equipment like hospital beds at home, wheelchairs, long-term care in nursing homes, yeah, those type of things. Medicare doesn't pay for long-term care. So the options for long-term care in nursing homes are private pay, and that could be, you know, a person is just paying from their savings or their income and assets, or there's long-term care insurance if a person buys a policy and that policy pays, or Medicaid. And even people who work and have middle income, Medicaid, long-term care is really expensive. You know, $12,000 to $15,000 a month. So even the person who did well in life, or, you know, just worked hard and, you know, followed the right path, a couple months in a nursing home could bankrupt just about any family. And when you have one person in the nursing home, but there's a family at home that still relied on their income, or, you know, needs to keep those resources in the family, it can be a very tough position to be put in. So these changes to the One Big Beautiful Bill are really impactful for that, particularly the dual eligible persons, but just in general, you know, Medicaid, you know, people may have a concept of Medicaid is just for, you know, people who just are at the bottom of the income level, but it's not actually true, particularly for seniors. So if there's no more questions, I'll, you know, just kind of go on, and I won't belabor. Oh, okay. Yeah. Yeah, well, it is, but I mean, like just in general in life. So people don't think about long-term care and how it can, you know, either drain a person's savings or life savings or finances. So even people who may have done well otherwise in life, and you get to, either towards the senior years, a person may end up having to apply for Medicaid because they've exhausted either all their funds in the early months or, yeah, so that's what I meant by that. Okay. And so one of the bigger things that the One Big Beautiful Bill has put into place for this year, starting this year, is it's now requiring or have work requirements. There are some exemptions for people who meet a certain criteria of disability, but there are work requirements. It's 80 hours a month. It is going to be required, or is now going to be required, either work or some community-based, I think volunteer. It's still not fully written out where every single detail or every single exclusion or provision is clearly stated, but it has implemented a work requirement for Medicaid, yeah, to get Medicaid. Next year, I'm just going to really start to highlight. Next year, 2026, there's going to be some enhanced premium tax credits on the Affordable Care Act or Obamacare. So to go back a little bit on that, during President Obama's administration, he created the Affordable Care Act, which is considered an expansion to Medicaid. So it allowed other people who wouldn't technically qualify for Medicaid to get certain credits, where they now can go on the marketplace and get health insurance for lower rates, or get certain credits that will allow them to private pay for insurance, because there's that gap. There's the people who are, have the $2,000 or less in the low income, and then you have the people who, are kind of in the middle and maybe don't have work-sponsored healthcare. And so, what do we do with those people who kind of fall in the gap? So once the Affordable Care Act came and the marketplace opened up, it allowed for people to pay for private insurance by getting certain tax credits. So those tax premiums are going to now go up. So people who were already struggling to pay for healthcare through the Affordable Care Act, it's going to increase those premiums. For many immigrants, immigrants, there are an exception. So there are 3 certain groups of immigrants that may or may not be affected when I say there's a lot of immigrant impacted factors in this bill. And that is I'm losing my train of thought on, that is the Cuban and Haitian entrants. That is the, LPRs. I'm trying to remember. It'll come back to me, so I'm having a brain freeze. But certain groups of immigrants are excluded from the exclusion. But for many people who are immigrants who are not legally here in the United States, their eligibility for Medicaid will actually end starting in 2026. Federal funding for Medicaid services will be reduced, and that just means, like, if there's a natural, disaster like COVID, there was extra money for emergency services for each state. That's going to be reduced. And I already mentioned about the Affordable Care Act premiums. It's going to end again for certain immigrants. In the next 2 years, 2027, those work requirements are going to be fully implemented. So right now it's, some gradual, they call it a good faith effort, that they're allowing states to have some wiggle room so they can create their policies and procedures, or their rules of eligibility and what counts as work, what doesn't. But in 2027, it's going to require that evidence of these work requirements are being met. And, what happens is if the state fails to meet any of these requirements, the federal government is just going to say, well, you can't have my money. It's kind of like, you have children and they say, oh, I want a new toy. I want a new pair of shoes. And you say, well, did you clean your room? Did you do what I asked you to do? Did you eat your vegetables? Well, if not, then you don't get the benefit. So that's kind of the relationship between the federal government and the states when it comes to funding. Catherine? So it's age 19 through 64. The requirement is 80 hours per month, so at least 20 hours a week. There are exclusions for the disabled populations, and there are some certain community service, like it doesn't have to be necessarily you getting a direct paycheck. You could be doing certain volunteer work, working with organizations, but they're looking for some version of productivity. Yes. Sure. Okay. The other thing in 2027, it just feels so loud. That's why. Okay, the other thing in 2027 is right now, eligibility redeterminations for Medicaid are every year or annually. They're going to be shortened to every 6 months for certain programs. And I don't want to go too deep, but under Medicare, the umbrella, there's so many different programs of Medicaid. So everybody doesn't have the same version of Medicaid. There's community Medicaid, there's the waiver programs, there's EID or employed individual with disabilities. So the rules are all different under those particular Medicaid programs, but the umbrella is Medicaid. Most of this is focused on the general population of Medicaid and not the sub programs in Medicaid. But the eligibility will move from annual to semi-annual.
Does that mean every 6 months you're going to have to review all that?
Yes, for Medicaid, not Medicare. Yeah, Medicare, there's no application process. Once you're eligible, you're eligible, particularly for those that are 65 and over who automatically get it. You don't have to apply. The minute they know when your 65th birthday is, Social Security does. So the minute you hit 65 and months prior to that, you'll start to get information about your eligibility and all of that stuff. But for those who come into Medicare being under 65, there's same thing. Usually you have to be on Social Security disability or SSI for 2 years. And on that 25th month, you automatically become eligible for Medicare. 2027 is the other one, and this has to do with, Medicare, the bill is reducing the home equity limit that it's going to be frozen at $1 million. So if a person is applying for Medicaid for long-term care, this is when this scenario usually is most helpful. If a person is applying for long-term care and they have a home, that home is generally exempted from the assets for eligibility. But now they're capping that home at $1 million. So if your home is worth $1.4 million, $400,000 of that home is now going to be considered part of your assets, and so only the $1 million. So that is going to be frozen. That's not a temporary change, and that is implemented in 2027.
Is there the trust and things like that? They put it into the trust. Did they take it away from the county?
So not for Medicare. Medicare is not means tested. It doesn't care about how much money you have. Medicare. Medicaid, and particularly long-term care, when it comes to trust, it depends on what type of trust. So if you have an irrevocable trust or, and things have been, your home or your assets have been retitled into the trust and you no longer have access to it because it now belongs to the entity of the trust. Those things are usually not counted. But when people have a revocable living trust, because while you're living, you're still considered the trustee, or you still have powers to put things out and take things out and put things into the trust. They'll say, well, you still have arm's reach for that thing. So you have the power to sell it, liquidate it. You have access to that money. So in that case, no. Just for time, I won't, go line for line, but one of the bigger things in 2028 and beyond is that enrollees, right now for Medicaid, there is no copay, except some of the programs like the EID program, but there's no copay right now. If you're eligible for Medicaid, there is no copay or monthly payment. But starting in 2028, there is going to be a either copay or some payment up to $35. And it's not a lot of money, but in the worst case scenario, that could be significant for somebody. So I'm just going to cover some of the cuts to Medicaid funding and just 5 main ones. And again, this is only in the Medicaid, Medicare sphere. The tax side of this one big beautiful bill is illustrious. It's a lot of changes, and it's pro middle income family. So there are a lot of benefits to the tax section of the one big beautiful bill, but these cuts are particularly what's outlined for the Medicaid funding. So states are going to be restricted, or they're right now states can charge as a way of funding. They are can charge providers and insurers a certain tax. And they're going to be either reducing or cutting out their ability to tax the insurers and providers. They're going to end the extra 5% federal match incentives for states that newly expand Medicaid. So, 5% doesn't sound like a lot. And I mentioned this in the first slide, but when we're talking millions and billions of dollars, 5% is significant. And so again, that's that incentive. Hey, did you clean your room? Okay, now you can have ice cream money. So it's the same with the federal government to the state. It's like, hey, did you clean up your books? Did you follow all of the one big beautiful bill's mandates? Oh, okay, if you did that, then we're going to incentivize you by giving you, an extra 5%. So that has been in place already, but there's not a lot of oversight. It hasn't been. There's not a lot of, the systems seem to not talk to each other. So, there's a lot of shortcomings between Medicare, Medicaid, Social Security, the federal government in general. They don't talk to each other. In my work as estate planning, a lot of times people, I close out an estate or a probate, and, the family is still receiving Social Security checks a year down the road. And then, here the government wants to now, come back, open up, put a lien on things. So, they don't necessarily know or aren't alerted when a person dies, when a provider dies, and they're still listed as eligible. And that just, pulls on the funds that we have in these systems. So just, and I think we covered this already, the work requirements, as I said, ages 19 to 64, 80 hours a month. Again, there are no automatic exceptions. You have to actually assertively say that you have an exception. So generally, like, certain conditions or disabilities are kind of like automatic. You don't have to prove it any further than to say, but now it won't be automatic. Those exceptions will have to be proven by medical documentation and otherwise. Yes. Mhm. Yeah. Mhm. Yeah. Yeah. It's and there's consequences. Yeah. Well, that's for the Medicaid side, not Medicare. Yeah, that's for the Medicaid side. Um, and those who are not compliant with the work requirements, they won't be able to get those subsidies from the marketplace. So, for the people who are in that sandwich and are receiving Affordable Care Act or Obamacare subsidies so they can get private health insurance, if they aren't compliant or reporting their work requirements, then they won't get those subsidies. And it's not written in the bill, but some analysis say that without those subsidies, the prices could look like, anyone ever had to use Cobra after a work event? And yeah, it's super high, right? Like almost, especially if you just left a job, maybe you don't have one, where you're going to get $700 every 2 weeks to pay for health insurance. So without those subsidies, it could be very, very burdensome. Yes. Yes, that's for Medicaid, not Medicare. So a lot of this is targeted towards the lower income population and the immigrant population who, by way of that. So Medicare, because it's an entitlement program, it's not much they can do to force income regulations. But by way of Medicaid, Medicare is going to take a hit financially in the budget. And it's going to, so if all these people, well, so it's definitely going to take a hit. So by way of these changes, it's estimated that about 5 million people are going to become uninsured. So, okay, we fixed, like you said, we fixed the we fixed the Medicaid issue. Well, if people don't work or they're not qualified, they don't get Medicaid. Okay, fine. But what happens when 5 million people have no health insurance? Does that stop us from getting sick? No. They're going to show up at the ER. They're going to use the emergency room as their primary care and flood the emergency room. And what's going to happen? Our healthcare standards, which are not the best, are going to go even lower. And who does that impact? All of us. Those with insurance, with great insurance, with mid insurance. So, this isn't a us versus them when it comes to these changes, or, or that doesn't affect me because I'm not Medicaid eligible. But by way of these changes, it's going to affect the healthcare system. It's going to affect the socioeconomic landscape. And so, just by general association, no matter what group you're in, it's going to impact all of us. But who are they going to write? Right. Who's going to? Exactly. Yeah. Big corporations, big farmers, pharmaceuticals, big insurance companies, Blue Cross, they're not going to take a cut in their profit. So where are they going to make up the money from? Us. Um, in what way? Yeah. Yeah. That I don't know the answer to on whether, yeah, it would be. That's a big number. That is a really big number. And like I said, yes, yes. hmm It is. It is. Yeah. And, no doubt there are some governmental inefficiencies. I mean, there needs to be some cleanup. There needs to be some system infrastructure to make it run better and more efficient. But, I don't know that 2 years of planning or 2 years of this implementation, 2 to 3 years, is enough to fix 100 years of, I think maybe the changes need to be more planned out ahead of time and not just, we wake up on July and all of a sudden our world is upside down. Catherine? Yeah. Yeah. It's true. But to undo some of these, it's, again, going to take Herculean government doing. Catherine?
So we're looking at what is considered every eligible working adult, right? From 19 until retirement. You need to show that you're uneligible to work every 6 months.
No, that you are working. Mhm. Right. Yeah.
That if I have a family member, say my son ends up injured and is in a long-term care, I'm still going to be his legal guardian, but he is in a long-term care. Is the long-term care facility going to be filling out paperwork that he can't work because he's in a long-term care facility every 6 months? Or am I, as the legal guardian, going to have to remember to do that every 6 months? My child doesn't get kicked out of a long-term care facility.
So whoever's filling out the application, generally when people are in long-term care, either the family fills out the initial application, but once they're in a facility, usually the nursing home, by way of, guardianship of the property, so to speak, takes that on and, will renew it. Just by nature of being in a long-term care, you have to meet the medical eligibility. So I would imagine that would be part of the exemptions. And again, one of the issues with this bill is, it's a bill and it touches on all these things, but all of these nuances and the specifics of, everything they're mandating has not been clearly laid out in some areas. So, these are the big ticket things they're telling us is going to happen or going to be mandated or going to be required. And well, how does that work? Or what if those questions haven't been completely answered? Exactly. It's a, yeah, it is. I only because I know this group and I probably won't, maybe I'll just go over it, but because I know part of what Catherine and Kip and I have talked about is, the home ownership program that they run. And I just wanted to throw something in here that kind of ties into how this one big, beautiful bill will have some impact on homeowners and that. So I just want to run through some of those. So when it comes to, and this is more laid out in the tax cut section of the bill, but it kind of, touches or crosses over a little bit. So one of the things or bigger things is there is a permanent $750,000 mortgage interest deduction. And it used to be $1 million in 2017. It was supposed to, stay that way, or it's supposed to be temporary. Now it's permanently $750,000. So when it comes to writing off your mortgage interest and insurance, it's now capped at $750,000. There is a reinstatement of mortgage interest and insurance premium deductions. And what that does is help to stabilize the market. So, there's some, like I said, there's a lot of pros and a lot of cons in this big, beautiful bill. I think it just determines where each person is, whether or not it's a pro to you or a con. But, you know, it's not one size fits all. There's a temporary increase on federal deductions for state and local taxes. It used to be $10,000. Now it's $40,000. So between 2025 and 2029, households who have an income of $500,000 or less, the deduction now is increased from $10,000 to $40,000. In 2030, it'll go back to $10,000. I think I mentioned the home equity cap for Medicaid is now $1 million for long-term care applicants. That comes into effect 2028. We saw that in the timeline. There's now no new, and this isn't a change, it's just there's nothing new. Federal down payment assistance for homeowners. So, you know, it didn't make any changes. So people will still have to, you know, try and find the programs that currently exist. There is not particularly for individuals, but it does impact the housing or the housing market. So there is a permanent enhancement of the low income housing tax credit, and that's really for construction companies. So it incentivizes builders and construction companies to be able to build more moderate or low income or moderate income, not really low, but affordable income, because it now allows for things like loans for garage apartments or what else? Backyard cottages, call those ADUs. So it allows for, you know, instead of people having to buy bigger houses and move out, they can now use the space on their land and they can develop it themselves to have more space, like, you know, maybe have an in-law place or use your garage for income producing property, or your kids come home from college, instead of having to build bigger, build more, it allows you to use your land and get, you know, mortgages or take out loans to build on the land that you have. So that will allow for construction of more affordable homes and help stabilize the housing market. Okay. And so, you know, it did put a cap on some of the remodeling, but it's now 150,000 for single dwellings and 195 for multi-space dwellings. So I just wanted to kind of bring in, you know, and again, most of this is on the tax side of the bill, but I think it's, you know, important. So I know I may have used up all the time. I know we started a little late, but I am definitely free to answer any questions. And again, if it's not related on what we talked about specifically, but in the realm of Medicare, Medicaid, Social Security, even estate planning or elder law, since I'm here. So if anyone has any questions, I can do my best to try and answer. Yes. I will do that. Does anyone online have any questions? Okay. Answers to. Okay. Mhm. Yeah. So the question was, where does one go to get legal help when it comes to navigating all of this without having to pay for a lawyer or don't have resources for a lawyer. So particularly for the older adult community, from what I understand, at least in Maryland, each county, either through the Department of Aging or your legal aid organization, always has a senior, what is it called? Senior Legal Services program that offers free estate planning, free advice for older adults. In my county, I'm out of Anne Arundel County and the Baltimore County area. I am, part of Maryland Volunteer Lawyer Services. Um, Actually, tomorrow I'm doing a talk for housing for Maryland Volunteer Lawyer Services, Pro Bono Resource Center of Maryland. So there are a lot of organizations. Some of them do have income requirements. They're not as bad as Medicaid, but you can often, people who have regular jobs can often qualify. But specifically for older adults, I believe every county has a single senior legal services arm of the legal aid, which offers particularly for seniors free estate planning services and advice. Oh, yes. Mhm. Yes. Yeah, so definitely your Department of Aging, your um, legal aid organization, they're always going to have some type of free program for older adults or seniors. Yes. DDA funding is disabled develop developmental disabilities. Um, yeah. So I didn't talk a lot, but the waiver program is for people who are under 65, usually for people who are in the community and are receiving um, long-term care versions or assisted living or home health care, probably not long-term care level, but home health care in the homes, or people with intellectual disabilities. Well, I mean, I just assume, although it's not written yet, that they will be part of that exempt group. Um, Again, the automatic exemptions were people which used to be defined as frail, but now because it's not defined, but I'm assuming people with developmental or intellectual disabilities, as long as they are receiving either SSI, SSDI, or some other disability type of support system. It would not necessarily affect them, particularly the work requirement. The Again, I mentioned earlier, under the umbrella of Medicaid, there's all these different programs. So the waiver program it used to be the living at home waiver, then the community home-based services program. So those are people who live in their homes, live in the community or group homes, but they need either round the clock or um, a significant amount of care for their activities of daily living. So, again, those are specialized Medicaid programs. They probably will not have any significant or substantial changes to those, not for the foreseeable future. It's not outlined in the big, beautiful bill that it's targeting the specialized groups. But so I don't think there's going to be any, according to what we know, there shouldn't be any major, the funding. So eligibility is one thing, enrollment and eligibility, but whether or not Medicaid itself has the funding to continue the level of funding. So a person might be receiving in their care plan, if they're in a group home or in a home-based services type of setting, they might receive 60 hours a week in care and, enough money to pay for modifications of the home. Or, there's a budget that each person has in their care plan. With the budget being cut, those services may be reduced. So they, instead of 60 hours a week, they may only get 40, or the modification budget might be lowered and the burden becomes on the family to build those ramps or to get the next wheelchair. Those type of things, again, have not been spelled out, but we can see the writing on the wall if the budget gets cut as significant as this bill suggests. But eligibility probably won't be affected. You said you had tons. Is there another question? I can. Yeah. It's an exception. So when a person, so part of my practice as an elder law attorney, I do pre-planning and crisis planning. So pre-planning is when people come to me and they're fairly healthy, but they, have concerns. Maybe they've seen it happen and they say, I don't ever want to be in that situation. So what do I do to make sure that if the day comes that I need long-term care, that I have my things kind of in as much order as possible. So things like the irrevocable trust, the Medicaid approved annuities. There's things that we can do to shelter certain money, that if the need arises for Medicaid, and it's not so much people say, oh, well, those people are cheating the system, but these are Medicaid's rules. They, so it's not cheating the system if they said these things are allowed. So, some, like I said, there's sometimes there's family at home that need those resources. And if they're all being swallowed up by the one, sick person, that has a ripple effect. So, I work with families to try and help them plan ahead, and long-term care insurance, if they can afford it, is, an option if they can afford it. If not, I look at the whole picture, but it's case by case basis. In crisis planning, on the other side, person was fine yesterday, tomorrow they're not, and they need nursing home care, whether it's a stroke or, some other emergency, and now they need long-term care, but they hadn't planned. So now they have all their money in the bank, they have all their things still titled in their name. And so now Medicaid says, well, you don't qualify. You have to spend every dollar you have until you have $2,000 left. And, you can go in a nursing home, but we're not paying until you're poor, till you're broke. So part of what I do is, again, these are Medicaid's rules, but, they're super complex. So most people, and definitely the nursing home staff, are not going to implement some of these exclusions. So for married couples, for example, the rules allow, generally, there's a way we can save 80% of a person's wealth from being contributed to their care in a nursing home to get them qualified. And a single person, our target is around 50%. So if a person comes to me and they say, I have $400,000 or $300,000, but I don't want to give it all. That's, 18 months in a nursing home. I don't want to give it all. I don't want to spend it all. I spent a lifetime. My children deserve something. Or, there's definitely ways that we can help spend down. We can do a gift in return. There's all kinds of strategies that can be used where not every dime has to be spent. And Medicaid, CMS created this rule themselves. And so we just take advantage of the COMAR regulations and the rules that allow us to do that. But you need a specialized elder law specialist or attorney to help with that. So it's not all black and white. And, so they're always going to look back 5 years and say, oh, 5 years ago, you owned a house, and you sold it. Where's the money? Where's the proceeds? And if you say, oh, well, it's in a longshore account, and if you can't account for it or have a legitimate reason that you spent it on, they're gonna attribute it to your assets. And, you know, again, that's when, you know, specialists like myself try to come in and navigate that.
We've hit the end of our
Yeah.
time for tonight. I know, we will probably answer a couple more questions up here while we are cleaning up. But Preet's gonna be back joining us in November for, our financial literacy series then. So as you've heard, she's an expert in so many aspects of, estate planning and, health,
Yeah.
public health and, financial health that way. So Perneita will be back joining us in November. Next month, we have, qualifying for a home for you. So based on what an individual's needs are, qualifying for the best home based on today's interest rates. I still don't get arms and points and things like that. So somebody who understands that much better than me is going to come down and explain that for October. And then we come back to Perneita in November. But thank you very much for joining us.
Thank you, everyone. I wish you all the best in navigating this one big beautiful bill, but we'll all be experiencing it together. And remember, we're all one big beautiful America, and what happens to the least of us happens to the greatest of us. So we have to do our best.
And we'll have you back to update us in a year after we know what all these requirements are.
Yeah.
All right. Thank you.
So, all of these presentations do get recorded, and you can add them to Calvert Library's YouTube page. Previous, sessions are also on the YouTube page. I believe probably about 4 months ago, we did also have, Rose Crumpleton, and she's also an estate planning attorney. So that series is on YouTube if you want to watch her.
Great, thank you. Yep, and they're all on YouTube. That one was strictly estate, so that'll be really good. Help on that. I'll make sure we have the link too.